Hi there, it's Dr. Danielle Kelvis here to talk to you about what an ambulatory EEG is. An EEG is what's called an electroencephalography, and it records brain activity, which is useful when diagnosing and guiding treatment for things like seizures or epilepsy. In recent years, EEG readings are being used to study a cohort of diseases, including migraines, depression, and PTSD, to name a few. Unfortunately, capturing brain activity during a seizure is extremely difficult. Healthcare providers can glean useful information from eyewitnesses, but in a true seizure, the patient is unable to recount the episode, right? So an EEG allows for the diagnosis of, complete, partial, focal, and generalized seizure activity. The typical test requires that a patient lay very still for a period of time while leads are placed on the scalp to record brain activity, which is then generated in a report for a neurologist or other licensed scientist to interpret. It's difficult and often impossible to trigger an epileptic episode in a patient while undergoing an exam, hence creating the need for a continuous ambulatory or portable EEG. This is very similar to like a Holter monitor that patients wear on their chest for, days to weeks to months at a time to record arrhythmic activity within the heart. While inpatient EEG monitoring is still the gold standard, ambulatory EEG, or better known as like a lowercase a and then capital EEG, is less expensive and allows for prolonged continuous monitoring. And studies show that an ambulatory EEG monitoring, on average, it picks up abnormal neural activity within like 2 days. So, advances in technology have allowed for family members and bystanders and nurses to press an event button when and if the patient begins exhibiting seizure like behavior, which allows the physician to focus on specific times, right, during the recording, with options to include video recording as well. Continuous recording allows healthcare providers to pick up on subtle nuances in brain activity, which can guide treatment decisions to, increase, decrease, or change a medication dose. Ambulatory EEG allows for more detailed studying and recording of physical movements such as dystonic posturing, eye deviation, brief TODS paresis, and post-ictal behaviors. Noting these movements clues the provider into the therapeutic nature or threshold of a patient's current treatment plan without subjecting them, right, to the uncomfortable process of having to trigger a seizure-like episode while inpatient. But many patients, as high as 40%, are found to actually not have a true seizure disorder at all upon undergoing, ambulatory EEG. Seizures can be caused by numerous things, from heart arrhythmias to substance abuse to transient ischemic attacks or TIAs that have been incorrectly diagnosed and subsequently treated as lifelong seizure disorders. Some studies have shown, however, that the inability to interact with a patient while they wear an EEG monitor increases the risk of potential artifacts and misinterpretation, hence why inpatient EEG tests still remain the gold standard. Typically, most patients are required to wear an ambulatory EEG for about 2 to 3 days, which makes sleeping a challenge. It's important to make sure you're sleeping in a cool place, as sweating can cause the electrodes to unstick on your head and lose contact with the scalp. Guidelines recommend that a patient wrap their head comfortably in a breathable white cloth to prevent the electrodes from moving too much during sleep. But if it's wrapped too tightly, the patient will not sleep at all, right? So this wrapping technique is tricky and can take a couple tries. So before taking the ambulatory EEG home, be sure to ask the technician or technologist to demonstrate and practice wrapping the head comfortably. Most facilities will provide the appropriate wrapping materials. You want to try to keep the wires neatly bundled and above the head so that if the patient and when the patient does turn during their sleep, they won't wake up tangled in the wires, right? And then accidentally remove the electrodes. So, in addition to wrapping, the most important thing is to adhere to the patient's typical sleeping time and pattern. Disrupting this will prevent the EEG from collecting vital information regarding their sleep and brain activity. Before starting any EEG recording, the patient should not consume any caffeine or use, any hairstyling products or oils beforehand. Your hair should be washed and dried, and instruct the patient, it's okay to take their medications as directed. Setup can take about an hour, honestly. So begin getting ready for bed earlier than normal to ensure the patient goes to bed on time.